So this is my another role as a medical oncologist. I also have an initiative called Voice of Cancer Patients. This is a platform actually where patients can talk to each other and use their forums. So as a background, cancer care requires multiple facets of the treatment, multiple cancer, and any treatment actually is, any patient is not treated in vacuum. It's just somebody says like you need a village to raise a child. Here you need multiple modalities to treat a cancer patient, which includes the family, hospitals, clinic, other caregivers, cancer survivors. And many of these patients want to hear from other patients about their situations, how they're doing. And they not only want to talk to other patients about what they're going through, but also want to validate their own issues and probably want to interact and maybe create a support group. So our aim at voiceofcancerpatients.com is to bring many different types of cancer-related forums on one platform so that the patients and caregivers do not have to search a specific forum for their particular cancer. And it can also allow them to follow the original forum that the answer came from. So it's basically, I can say it's a Google of the patient-related cancer forums. And we also use machine learning and AI techniques to actually analyze what patients are talking about and their reported insights. So many of these forums are actually originating in North America and Europe. And these are some of the names of the forums that I've actually put: breastcancer.org, forum breastcancernow.org, and cancer.org, and such as like that. Most of these forums are actually written by Caucasians for Caucasians, and we don't have such forums coming from Southeast Asians. So I would like to actually offer this platform to Southeast Asians, because every community has significant cultural and genomic differences, and we could like to get some insights as well as their preferences, in regards to cancer care, and maybe correct some of the disparities in cancer care all over the world. So the way this works is we collect the forum data in form of unstructured text, and then use machine learning technology using natural language processing and machine learning to kind of mine this data and then get insights about their cancer attributes, patient attributes, their symptoms, what they're going through, medications, side effects, and other informations. So that is what is different that this platform does, besides providing the forum and the platform to every other cancer patients. So we have used this forum to kind of analyze from Voice of Cancer Patients. Some of the examples are early on, I have presented this data to many international conferences. One of them is analysis of patient concerns regarding the cognitive deficit, which is a chemo brain after the treatment with breast cancer. And actually we found that, chemo brain is how common the chemo brain is, and the insights and the therapies that patients are using to alleviate their symptoms. Another one was association of family history and genetic mutations in breast and ovarian cancer. And we have put all of these things as a small articles on the site. So actually, I'm going to show you how the slide works, and I hope it works. So basically, I'm sharing voiceofcancerpatient.com's website. So this is the screen, the initial screen. I was talking about the breast cancer. So let me actually show you so this is the community here of the patients. Here we have put in articles about various analysis that we have done. These are very patient-friendly articles. These are stories that patients can put on. And let me actually go on the main screen of the Voice of Cancer Patients. I'm not able to go back to the initial page. Okay. let me see if I can go to the, yeah. So this is how the website actually looks like. These are all the different type of cancer forums. So this give you an aggregate of the drugs, side effects, supportive therapy, and sentiments. So I'm going to actually stop talking about, so I'm going to basically, I want to offer this site to everyone who may have cancer or their loved one who may have cancer. And this is a very powerful resource. We have more than 50 million messages from various forums. You don't need to know which forum to go to. If you just ask a question, it'll give you answers from various forums related to that type of cancer or that type of drug or that type of side effects, and one can get insights. I'm going to stop this share and then go back to my original one. Let me see. Okay. Okay, and then in the end, I would like to just talk to you about future directions where we're going. I'm in the process of creating an online patient navigation system, which will provide the next step for the cancer treatment. So we'd like to blur out the rest of the information. There is a lot of information available for the cancer, but many times patients get very confused with all this information. So this navigation system will provide the next step in the cancer treatment. And these are the validated steps taken from NCCN and ASCO guidelines. And we are also going to link the local resources for that particular stage and type of cancer.